Welcome back to Two Gals in a Glass Half Full. We are still in the month of October, oh my goodness, and talking about all things breast cancer. Last week, we spoke with Dr. Buckley about her personal experience with breast cancer and how she used both Western medicine and functional medicine to overcome it. And this week, we're going to talk again with Dr. Buckley about things we can do to prevent and be proactive for breast cancer or any cancer. But before we get started, Dr. Jess, what is in your glass?
So I'm working on my water. I've got a nice bottle of water here. So really trying to just keep, emptying it and then, inside of me, and then drinking some of my water that I keep in the fridge. So I've got all sorts of good stuff in there, like lemon and mint and what's this week? Lemon, mint, cucumber, and ginger. And so I kind of get some infused water, some regular water, and I just keep as much as I can all day, stay hydrated. So Dr. Bobbie, what's in your glass?
I am on water, so just trying to drink as much water as I can. I did just have a soda. I really enjoy my one soda a day. It's kind of like my guilty pleasure, but water before it and water after it.
There we go. So we've got Dr. Buckley coming back, and we'll hear what she has to say about, just from her vantage point as a functional medicine provider that does consider health in a more a pretty holistic way. What are just some of those simple strategies that people can implement into their lifestyle to help decrease the risk of developing cancer? So here's Dr. Buckley.
One of the things I'm curious about, so you're mentioning the hyperbaric. So is this something would a functional medicine provider have to prescribe that for you to go somewhere to do hyperbaric? Or how would that work if this is somebody that's not in the Jacksonville, Ponte Vedra area?
So yeah, generally, let me slow down. So generally speaking, when you go to a hyperbaric therapy center, there is somebody who can prescribe it for you.
Right.
So you don't necessarily have to have a separate provider who will prescribe for you.
Mm-hmm.
Sometimes you do, depending on how the clinic is set up. And a lot of times what people will do is they will start out with a few treatments in a center. And then oftentimes renting a chamber is even more cost effective. So you can rent one to have at home. I'm very, very blessed to have, because I have a clinic with functional medicine and I do have chambers. I actually also have one at home. So we have a backup available and I keep that at my house. So I just was at my house and in that chamber nonstop. Mm-hmm. But there's, when you're talking about mild pressure hyperbarics, there's really no limit on the amount of time you can spend in there. There's argument that we actually once lived at that kind of pressure, the 1.3 atmospheres. So there's no limit to how much time you can spend in there. And that's why, renting it makes it a lot easier, because then you can just crawl in at any time you want to.
Yeah, I can imagine.
You don't have to leave the house, which is nice sometimes, when you're not feeling good.
Yep, just get in there in your jammies.
Right. And then, so you were mentioning the vitamin C and some of the infusions. So I've seen these places that pop up in strip malls that are hey, we do vitamin C infusions and other infusions. Is that something that you would consider to be legitimate? Can we trust that? Or is this something that you would say no, probably look to more of a medical office with a physician there?
Yeah, so I especially when it comes to treating cancer, I think that it's really important to have individualized care and to be able to adjust things. So when we work with somebody who has cancer, we start with a much lower dose of vitamin C and work up to the dose that person needs or that can tolerate. Sometimes in the pop-ups, they actually get things that are shipped in and that are pre-mixed. And so they don't have any variability on that. And you really run the risk of things becoming oxidized and therefore not useful to your body. If you're in one of those kinds of clinics, I mean, they have their place. There are lots of people who are using them and using them and feel better as a result of it. But I don't think that that's necessarily what I would have somebody who has cancer do. So I would be a lot more comfortable if people were choosing to go with somebody who's practicing functional medicine and knows how to do these things carefully.
Yeah, that was kind of my guess.
Yeah, there's definitely a difference between, a healthy body receiving something and then, someone fighting cancer, for example. Just the needs are a little different there.
A little.
Yeah.
Right, yes, just a little.
And you just never know, like the level of education, the level of training, so I mean, I hate to say it, but like anybody can sell you anything, they can say anything. And so I just get a little nervous when somebody that's not like professionally trained is saying that they can manage illness, right? And so that's where I'm like, I feel like that's a leap that I just can't make. So I'd rather, when we're talking about a condition specifically versus like generalized like health, that really working with a provider is a good thing to do, and somebody that has experience with your good diagnosis is a good thing to do, not somebody that's just looking for business. So yeah. So from like a prevention standpoint, so like knowing your functional med and the background with functional med, is there anything that you think is just like generalized like advice for like what we can do to overall decrease our risk of cancer? I mean, I know we can't obliterate risk of cancer, but like at least decrease it from what you've seen and what you've learned.
Yeah. So, I think the most important thing that we can do is be willing to look at what we eat. Because way back when God was a child, food was our only medicine. And I think that we forget that. And so I think that the most important thing that anybody can understand is that cancer loves sugar, and cancer loves anything that turns a food that turns quickly into sugar. So highly glycemic foods. And it was tough for me when I kicked sugar. I am not an addictive personality. That's not who I am, but I'll tell you what, giving up sugar, I will say I jonesed for 3 weeks. It is an incredibly addictive substance. But once you get rid of it, you just kind of go, wow, people are eating and drinking things that are so sweet, and you almost can't taste anything else for the sweetness. And so I think that that's a really, really important thing to acknowledge. And the other thing that I personally feel really strongly about is that gluten launches an incredible inflammatory response in anybody's body, and inflammation is the opposite of what you want when you're talking about cancer. You want to be as anti-inflammatory as possible, and gluten's inflammatory response that is lit is not a little bit of gluten might give you a little bit of inflammation. A little bit of gluten lights the entire inflammatory cascade. It's going like crazy. And it may last for as long as 6 to 12 months, 6 to 10 months and so it's a big deal. It's a lot of inflammation to have in your body. So I think that probably the most important thing that you can do is be willing to look at what is an anti-inflammatory diet and how should I do that. And the short answer, I think, is becomes look, it's a lot like a Whole30 diet. It's a lot like that. And so to the extent that you can do that, that's what I encourage people to do, no matter what their medical problem is. And that is, eat the rainbow, get rid of as much grain as possible, but especially your gluten. Don't eat processed foods that are full of chemicals that aren't really food. I teach Boy Scouts, if you can't pronounce it, you shouldn't eat it. Read the label. If you can't say it out loud, Jude, don't take that home. Don't eat that. And the thing that's important to remember, and I've heard people say this, and it just makes me sad. I can't do that. we can't do that in our family. We can't do that. I can't do that. I can't do that. And Sid Baker has said, my guru, most people would rather die than change their diet. And, when you're talking about cancer, that's a reality. I mean, that is literally the truth. I hate when it happens to people, but there's nothing quite like, oh my God, I might die, to kind of have you say, well, maybe I should look at what I'm eating. That was probably the motivating factor for me. I had worked on my children's diets tremendously because of my daughter's autism, but I hadn't walked that walk. I talked the talk, but I wasn't walking the walk. And man, when I got cancer, the whole household, it was like, that's it. Don't bring any of that stuff in my house. It's gone. So I think that's probably the most important thing there is in terms of prevention. The other stuff is, the exercise. The human body is designed to move. And when it doesn't move, you get into trouble. And it is a really, really critical thing. So today I was talking to a almost 16-year-old girl. And I had to explain to her what was functional medicine. Why had her parents decided that she needed to come and see me? Because she was like, why are we here? What are we doing? And I explained that to her. And I said to her, look, you're 16. You got to pick something. I don't care what it is that you pick, but I want you to pick something that you like doing, that you are willing to do every day for the rest of your life. And you need to move your body. And I want you to make sure you're moving your body at least 5 days a week, at least for 30 minutes at a time. And she just looked at me and I said, it's really important. It's going to be good for your endorphins. It's going to be good for maintaining your blood glucose and all these other things. I mean, it's just really, really, really good for you. I have had the terrible problem for the last year of, I ruptured a meniscus in my knee, and then I took too long to take care of it. And and I have been literally in physical therapy. Then I ruptured part of my rotator cuff. And for a year, I have not been able to get out on my kayak, which is my favorite thing in the world to do. And I am a much crankier, much more difficult person without getting out on my kayak, and I'm just now getting to that place of I'm about ready to be able to get out there again. And I'm so excited, and I will be a much better person for it. And my body will be very happy and will live longer and be less likely to get cancer back and those kinds of things. So I think that the diet and the exercise are the number one and number two things that you can do to prevent cancer. That's it.
Yeah.
About Jess not getting her tennis and being crabby.
My mood, like I'm a movement person big time. And so, but Dr. Bobbie's referring to is, so we were in graduate school together, and I love playing tennis, and it's just like that, it gets me out of bed in the morning. And so I love the movement part of it. I love the coordination. I love the problem solving, the strategy. I love all of it. And so I had 2 tennis partners in graduate school, and neither could hit. It was just one of those frustrating weeks. Who knows what we were frustrated about, but something, probably a bunch of tests or something. And so Bobbie shows up and she was like, okay, let's go play tennis. And she doesn't play tennis. Bobbie's a gymnast. Okay. And so but it was so great because she showed up for me. She showed up and she's like, listen, I'll feed balls and then you can just hit them wherever you want. I'm not going to hit them back, But the thing is that her showing up and supporting me in that way was exactly what I needed. I needed that physical release, when you're in a stressful environment, like graduate school, like any work environment where you having to perform at this high level, sometimes you just need that release. And then it's like, all right, now I can handle life. And so, now, I'll be stressed about something or frustrated and I might not be able to put my finger on it. I'm like, I need to make time for a run. And every single time I come back in, I'm like, okay, I can put my finger on it. So now it's just boom, I come so much more clear-headed. So it helps me with my health, obviously, and just so much of like the mental benefit, the endorphin release, keeping everything regulated. It's so good. I'm not going to sit there and spin my wheels forever. I can just tell. I'm like, I'll be back.
Well, I think that's an important point, in terms of also with cancer, is allowing a support system to form around you. Most of us are, I've got this, I can do this, I don't need anybody's help. And I will promise you that one of the big challenges for me was to let go and to let other people help me, and to let other people love me, and to let other people be supportive, because I am so accustomed as a provider to giving rather than receiving. And so I did, I had to allow that. And it was really very, very rewarding. And the other thing that I think is very helpful in terms of prevention, and then also in part of your treatment, is to laugh and to make sure that you are laughing. I watched The Proposal, was a movie that had come out, and I watched that, I don't know, 100 times, because it just made me giggle all the time. I watched it and watched it and watched it. And so I made sure I was laughing. And, somebody tell me a joke, so, make me laugh. And I think that's another really important part of the whole process, and prevention.
Yeah.
As I say that they say laughter is one of the best medicines. So
it is. I read this article, it wasn't that long ago, and it was saying that, so there's this lady, it was a podcast I listened to, but anyway, there's this lady that was talking about her research on laughter, and why don't we see people laughing that much, right? So she did all of this research on it and found that up until the age of 20, you laugh a good amount, and then again when you're over 60. That's so sad. I'm like, what? And so it's like, somehow we enter the workforce and like life has to be serious. It's not funny anymore. And I was like, I see that actually. Like when I was hearing her talk about her research and everything and all of the health benefits of laughter, like, what happens at the level of the brain and the release of the endorphins and everything that happens that's so beneficial physiologically. She was like, why don't we laugh? And there's a lot of stress in real life. There is. Financially, it's hard. You're trying to balance so many different things between work and families and interpersonal relationships and all this stuff. And at the same time, it's like, can we have fun at the same time? Like, here in the clinic, I'm always like, we make our own rules. Like, I don't know, like, if it doesn't work, it doesn't work. If it does, it does. Like, it's not that serious. It really isn't. Like, let's just show up and let's do our best to have a good day. And hopefully we laugh a little bit. That'd be great. I would love that. So not every day is like, we're not like giggling and laughing at every moment. At the same time, though, like, there's things that are funny. Like, say it out loud, as long as it's not disrespectful. Like, yeah, have fun. Yeah, I love it. So perfect. So Dr. Buckley, if we have somebody that's listened all the way through to this episode and they're like at the end, and you're like, what's like the one like takeaway? If we only remember one thing after listening to this, like, what would that one takeaway be of like, bring it home and really remember this?
Wow, that's a really good question.
And it's hard, right? Because there's so much.
Yeah, there is. Because
it's heavy.
it's so funny, because as soon as I started thinking about that, I realized that one of the things that I didn't say was my faith was critical to me, and prayer and meditation and I did a lot of guided imagery with of affirmations of health and affirmations of my immune system is doing this and this and this, and surgically my body is recovering from XYZ, PD, and Q. And so that was another huge piece of what I did. I think if I had to sum it up, I would say that in terms of prevention and or terms of treatment, when we're talking about cancer and breast cancer, it is to find a willingness to take care of yourself. And especially for women, I think that's very difficult. We get into a role of being a wife and a mother, and being very other oriented. And we tend to defer taking care of ourselves. We tend to let that fall by the wayside. If there's 12 things that have to happen today, the other 11 are going to get done, but I may not take care of myself. And I think that's probably one of the most important things, that if there's one takeaway, it is find your ability and be willing to take care of yourself and take care of your body and take care of your mind and take care of your spirit, so that you can stay on a path for wellness and you don't end up, it's not fun to find it after you've got cancer. It's a lot easier to find it beforehand and to get good at it that way.
Yeah. I was gonna say, listening to you talk, I think one of the things that I have taken away most is also just keeping an open mind. Keeping an open mind that chemo and maybe radiation or whatever, the Western med is good. Keep an open mind to other options, and Western can be good, but maybe if you combine them, it will be better.
Mm-hmm. And when you think about like that holistic approach of adding in the mindset part of it, and tapping into your own immune system, and a lot of, like, from my perspective, functional medicine helps to empower the patient. So you're not a passive receiver, you're an active participant. And I think that's what resonates with me a ton with functional medicine, because as a physical therapist, I need you to be an active participant. I can't do it for you. We have to work together. And so it's always kind of bothered me with how medicine works many times, is that people are taught to be passive receivers and dependent and not empowered. And it just never really made sense. I mean, like, my husband was diagnosed with rheumatoid arthritis, and nobody talked to him about dietary changes or changes to his exercise or all of this other stuff. So obviously I go into this deep dive about gluten and, like whole food living and all of that. And I was like, just throwing stuff out of the house. Like, we're not even going to give this away. Nobody should be eating this, Right. Honestly, I was like, I can't even donate it. And it just like, and it's just so interesting, because then when he does his, follow-ups and stuff like that, they're like, how has it been this long and you haven't had a single flare? He's like, have you met my wife? I'm not allowed to. So but like, for real, like, just really like saying, like, keep this open mind, and like, that's what I was telling him, like, you need to come first right now. Like, what can you do to take care of your body? And I have to do the same thing for me. I have to take care of my body. And then, our children, same thing. It's like when you put you first and you put your oxygen mask on, you're stronger for everybody around you. And it's so hard to think about that metaphor, putting your oxygen mask on first before helping the person next to you. And that has resonated big time with me. And functional medicine, I think, is like so on par with that, So no, I love that, every part of that. Yeah. Cool. All right, Dr. Buckley. Well, we really, really appreciate you coming on and sharing your knowledge and your experience.
It's my pleasure.
And hopefully, people listening to this will share it with somebody else. And if you know somebody that might find this to be helpful, and so just keep spreading the word that there's a lot of information out there. It just might not be like right up in your face. You might have to deep dive it a little bit.
Yeah, I did write a book after I finished with breast cancer.
Oh, we'll link it.
Okay, yeah, it's
Yeah.
Well, if you shoot it to us in an email, we'll link it.
Okay.
That way everybody
Sure.
can see what it is. Yeah. All right, everybody. So stay tuned. Next week, we've got another breast cancer survivor that we're going to be talking to, and her experience, which is going to be just everybody's experience is different, and then what she's learned and grown from there. All right. Thank you for listening to the episode today. If you would like to learn more about how Two Gals can support you, then join our Two Gals Insiders membership, which can be found at www.2-gals.com. Also, don't forget, follow us on social media. We're on Facebook as well as Instagram. Okay, everybody. Bye. Enjoy your week.